As we grow older, our bodily functions gradually decline, and our sense of balance along with the inner ear's ability to regulate equilibrium may weaken. Many seniors experience unsettling episodes of dizziness, those moments when the world seems to spin uncontrollably, as if the very ground beneath their feet were shaking or their vision fleetingly blurred. Robert, a pseudonym, once explained, "Sometimes when I wake up in the morning, I feel as though a tidal wave has hit me, everything becomes fuzzy, and I worry I might lose my balance and fall." Such sensations not only diminish quality of life but also significantly increase the risk of falls and consequent injuries. In recent years, the problem of dizziness in older adults has emerged as a major challenge in geriatric healthcare. Recognizing early signs of dizziness. Elderly dizziness does not occur abruptly, rather, it develops subtly over the years. The body sends warning signals that should not be ignored. Consider the following indicators that your body may be alerting you to an underlying imbalance. Morning unsteadiness. Upon first opening your eyes in the morning, you might feel as though your head is light and your feet heavy, with the surrounding scenery swaying as if you were drifting on clouds. This sensation is common among seniors who have experienced years of physical frailty and may signal early dysfunction in the inner ear's balance system or neurological regulation. Transient, recurring episodes. Some seniors notice brief spells of dizziness when walking, turning abruptly, or even when changing positions, episodes that last only a few seconds to a few minutes. Although these episodes tend to resolve on their own, their repeated occurrence throughout the day could suggest that your brain is receiving inconsistent blood flow or that your neurological control systems are faltering. Accompanying headaches and blurred vision. In some instances, episodes of dizziness are accompanied by mild to moderate headaches or moments when your vision becomes double or blurred. Family members may worry that these symptoms herald more serious conditions, such as a minor stroke or a transient ischemic attack, emphasizing the need to monitor such occurrences carefully. Sudden, severe dizziness. A particularly alarming sign occurs when you experience an intense bout of dizziness upon waking, one that is so severe it comes with facial stiffness, slurred speech, or weakness in your limbs. This type of episode can signal an imminent stroke or another acute cerebrovascular event and necessitates immediate emergency medical care. Everyday triggers and risk factors. Many seniors mistakenly dismiss dizziness as a normal part of aging, but daily habits often unknowingly exacerbate the condition. Understanding these triggers can help you make lifestyle adjustments that protect your balance and overall well-being. Rushing out of bed. When you leap out of bed immediately after waking up, your body hasn't yet adapted to an upright posture. This abrupt movement can cause a temporary surge in blood pressure, increasing the load on the heart and reducing blood flow to the brain, which may trigger brief episodes of dizziness. It is advisable to take a moment in bed, sitting up slowly, allowing your cardiovascular system time to adjust, before standing up. Extended periods of close-up work. Long hours spent reading, sewing, or using the computer, where you consistently lower your head, can fatigue your neck muscles and compress the blood vessels that supply your brain. This restricted blood flow can lead to dizziness. Taking regular breaks to stretch your neck and eyes, along with practicing simple head rotations, can help alleviate pressure and improve circulation. Irregular sleep patterns. Chronic sleep deprivation, frequent nighttime awakenings, or erratic sleep schedules disrupt the delicate balance of your nervous system. Many seniors who do not get sufficient or quality sleep experience persistent or recurrent dizziness. Establishing a regular sleep routine and ensuring a restful, dark environment for sleep can make a substantial difference. Chronic stress and emotional fluctuations. Persistent stress and anxiety can interfere with proper blood circulation and nerve function, thereby exacerbating symptoms of dizziness. Even though some seniors believe that their emotional state has little to do with physical symptoms, maintaining a healthy mental attitude is crucial. Techniques such as mindfulness, meditation, and therapy can help manage stress and stabilize your mood. Inappropriate medication management and neglected chronic conditions. Many seniors rely on multiple medications for conditions like high blood pressure or diabetes. However, These drugs sometimes have side effects that disturb blood pressure stability, leading to dizziness or even fainting spells. In addition, if chronic conditions such as hypertension or diabetes are not adequately controlled, the risk of dizziness increases dramatically. Regular consultations with your healthcare provider and periodic monitoring of your health indicators are essential for preventing complications. How to effectively manage elderly dizziness? Simply attributing dizziness to just getting older and relying on home remedies like a strong cup of herbal tea or a daily vitamin regimen can be dangerous. Immediate action and professional care are key. Experts recommend that when persistent or severe dizziness occurs, especially if accompanied by alarming symptoms like facial drooping or confusion, the following measures should be taken without delay. Seek medical evaluation promptly if dizziness persists or suddenly intensifies, especially when linked with signs like facial asymmetry, speech difficulties, or loss of consciousness. Immediately contact a physician or visit the emergency room. A thorough neurological and cardiovascular assessment is critical in identifying the root cause of your dizziness so that targeted treatment can be initiated. Adjust daily routines. Maintaining a structured daily schedule is crucial. Ensure you get enough sleep every night and follow a consistent wake-up routine. Complement this by eating a balanced diet that is low in fats and salt but rich in essential vitamins and minerals. Additionally, incorporate moderate physical activity such as walking or practicing Tai Chi. These exercises not only promote circulation but also enhance overall balance, reducing the frequency and severity of dizzy spells. Monitor medications and health metrics for those on long-term medication regimens. Regular self-checks, such as monitoring blood pressure, blood sugar, and cholesterol levels, are vital. If you experience any side effects like sudden drops in blood pressure, notify your doctor immediately so that your medication dosages or types can be adjusted accordingly. Encourage emotional and psychological well-being. The stress and anxiety brought on by recurrent dizziness can lead to a vicious cycle of worsening symptoms. It is important to seek mental health support when needed. Family members and community organizations can also play a role in offering counseling and social support, fostering an environment where seniors feel secure and understood. Prioritize preventive health checkups. Seniors with a history of dizziness or a family history of balance disorders should prioritize periodic health examinations. Early detection of any irregularities in brain function or inner ear balance can allow for timely lifestyle changes in medical interventions, greatly reducing the risk of severe events such as strokes. Consider at-risk groups beyond seniors. Although dizziness is most prevalent among the elderly, it also affects other groups. Children, for instance, may experience brief dizzy spells following viral infections, and middle-aged adults, overwhelmed by work stress and irregular lifestyles, might also suffer from episodes of unsteadiness. It is important for parents and professionals to monitor these symptoms and seek appropriate medical advice if they occur frequently. Case studies and practical suggestions. Consider the story of John, a 72-year-old gentleman who had long dismissed his mild dizziness as just part of aging. One afternoon, while taking his routine walk in the neighborhood, John suddenly experienced a severe bout of dizziness accompanied by flashing spots in his vision. Thanks to a kind neighbor who quickly came to his aid and escorted him to the hospital, doctors discovered that John was on the brink of a minor ischemic stroke. With timely intervention, and after a carefully crafted regimen involving adjustments in his sleep, diet, and medication, John's symptoms noticeably subsided, and his quality of life improved dramatically. Similarly, take the experience of Mary, a 68-year-old woman burdened by chronic insomnia and frequent mood swings. Every morning, Mary would wake up feeling dizzy and disoriented. After seeking professional advice, she committed to a routine of gentle morning exercises and stress relief practices such as meditation. With guidance from a nutritionist, Mary restructured her diet, increasing her intake of light meals like porridge and steamed vegetables while reducing fatty and sugary foods. Over time, Mary observed a significant reduction in her dizzy spells and enjoyed a more stable and energetic disposition. Future outlook, proactive management for healthier aging. Modern medicine has made remarkable strides in understanding the mechanisms behind dizziness in the elderly. However, the challenge remains: how do we translate this knowledge into actionable strategies within communities and households to improve seniors' daily lives? There is a growing consensus among healthcare professionals that increased awareness of the early warning signs of dizziness, and proper early intervention, can make a critical difference. Through community outreach, educational programs, and regular health screenings, individuals and their families can learn how to effectively monitor and manage balance problems before they lead to serious injuries. Moreover, personalized treatment plans that take into account an individual's medical history, lifestyle, and specific symptoms are becoming the standard in combating chronic dizziness. By combining lifestyle modifications with customized medical interventions, ranging from dietary adjustments and physical therapy to judicious medication management, healthcare providers can greatly reduce the overall incidence of dizziness among seniors, ensuring that each person enjoys a safer, more independent later life. Dizziness is far more than a minor inconvenience associated with aging; it is a condition that demands our collective attention. Whether you are dealing with an occasional bout of lightheadedness or have been struck by a sudden, severe dizzy spell, it is imperative to approach this issue with a proactive, science-based mindset. Family members, healthcare providers, and community organizations must work together to monitor seniors' health, provide appropriate support, and foster a safety net that minimizes risks for falls and other injuries. Remember, maintaining a regular sleep schedule, following a balanced diet, and engaging in moderate physical exercise are foundational steps for preventing and alleviating dizziness. By taking responsibility for your own health and paying close attention to early warning signals, you can dramatically improve your quality of life and enjoy a future marked by stability and vitality. May every day bring you renewed balance and confidence, and may your journey toward improved health be guided by timely action, informed choices, and steadfast support from those who care about you. Together, we can pave the way for a life free from the disruptions of dizziness, embracing each day with clarity, strength, and a commitment to overall well-being.